The diagnostic model hasn't changed since the days of Abraham Lincoln being diagnosed with depression. Diagnostic labels, by the way, that aren't based in neuroscience, they're based on expert opinion, usually a quick fix.
Dr. Stephen Storage, a board-certified child, adolescent, and adult psychiatrist trained at UC Berkeley, UCLA, Stanford, and USC. A former clinical assistant professor at USC's Keck School of Medicine who earned top teaching awards, mastered the system, and then walked away because he believed it was fundamentally broken.
A patient see their brain and see how it's firing just as an image and break down in tears is a high number.
Today, as a lead clinician at Amen Clinics, Los Angeles, Dr. Storage is helping reframe how we understand the brain.
I see commonly revenge insomnia, which I've worked so hard today. I'm just going to stay up a couple more hours because I deserve this time and I need this time. ADHD, it's more impulsivity and, behavioral regulation. And OCD, it's more regulating our thoughts. But other things too, skin picking, hair pulling, tic disorders, all of those are associated with reduced activity in the prefrontal cortex, even binge eating.
The more you know, the more the unknown grows. I am Jitesh Vaswani, your host, and together, let's take this journey beyond the known.
Stephen, I welcome you to our show.
It is so good to be here, and thank you for that kind introduction. I'm excited for our conversation today.
Absolutely. And you were at one point part of the system inside, right? Like you were professor teaching psychiatry, and then what made you walk away from that traditional way of viewing mental illness? And that's what I'm most curious about. What triggered it inside of you?
My story of getting into psychiatry in the first place is sort of roundabout. I went to medical school having no idea or intention that I would become a psychiatrist. I enjoyed science, I enjoyed people, connecting with people, helping people. I always thought maybe I would do emergency medicine or surgery. And then I had my psychiatry rotation in the third year of medical school, and I found it fascinating to just be with a person, connect with a person on a deeper level, not be looking at just lab values and numbers, but really to try to understand someone at their core. And that ultimately, plus the mystery of the brain, is what pulled me into psychiatry.
Right.
And then I started practicing psychiatry, and it didn't have that same spark as it did as a medical student, because ultimately, psychiatry as an institution is good enough. It helps enough people that it survives as an institution.
Right.
But it's not something that I think we should be super proud of, because the diagnostic model hasn't changed since the days of Abraham Lincoln being diagnosed with depression. It's the same model, and that model is two people sitting like this, having a conversation, but ultimately the conversation being rushed.
Right.
Symptom checklists.
Yeah.
Taking that checklist of symptoms, aligning it to a diagnostic label that's the best fit. Diagnostic labels, by the way, that aren't based in neuroscience, they're based on expert opinion of people sitting around a table saying what symptoms should go with what diagnosis, and then ultimately, usually a quick fix. Here's a prescription to go with that diagnosis. And that just wasn't very interesting or fulfilling. And so ultimately, I've long held the notion that mental health is much deeper than just symptom clusters. It's brain health. And the brain can't be overly simplified into a diagnostic label. And so that's ultimately what led me to join Amen Clinics, because that's their model.
Interesting. So how many years of traditional psychiatry were you doing before you made that switch to, Amen Clinics?
I was on faculty at USC for about 5 years. And then prior to that, fellowship was about 2 years, residency 3 years. So in total, about a decade.
So let's go deeper into the brain health, right? So you said mental health could be brain health, right? Like, so now there's like we're going from an intangible thing to something tangible within the body, right? Now, what does that mean for someone living, quote unquote, a mental condition, right? Like, how does someone go about accessing it right? And then going into recovering from it.
Absolutely. So, I mean, I like to start off by telling people just how complicated the brain is. And even though it's this, relatively small organ between our ears that we don't see or really think about, it has more connections in it than stars in the universe. And that number is literally astronomical, right? It's 100 billion stars in the Milky Way galaxy. It's one of 100 billion galaxies. And that's a conservative estimate for the number of connections in the brain. And that organ is driving everything. Every thought we have, every emotion, every intention, everything. So to think that we are driven by such a powerful organ is the first step, right? To acknowledge that. The second is to see what that wiring actually is. And so in our clinic, we do functional neuroimaging. We use a technology called SPECT scans, which stands for single photon emission computed tomography. The idea is you're looking at blood flow in the brain, and blood flow matches activity level. Okay. So if there's a certain part of the brain that is receiving lots of blood flow, more than expected, it tells you it's a hyperactive region. And if similarly there's a part of the brain that's receiving less blood flow, that's a sleepy region of the brain. And so with that technology, coupled with a long conversation with a person, connection, neuropsych testing, right? We put all of that together to try to more deeply understand how someone's brain is actually firing and what it means. And ultimately, the goal of psychotherapy, in my mind, is to build insight, right? It's to understand why we feel the way we feel, why we think the way we think, because that's the first step to doing something about it. And in the same way, these types of images are sort of accelerated psychotherapy. The amount of times I've had a patient see their brain and see how it's firing just as an image and break down in tears is a high number. Because ultimately when we see where it's coming from, it helps reduce shame, it helps reduce stigma, it helps us love ourselves a little bit more, because so many people who are dealing with depression or ADHD or any ailment have been told that they need to try harder, or it's all in their head, which I don't even know what that means, because I guess that's true, the brain is in your head. But when you see what's actually happening and you realize that if that pattern of blood flow were to occur in anyone's brain, they would probably feel similarly. And then to acknowledge that that pattern of blood flow is based in biology, but also environment, psychology, spiritualism, all of these things converge on how our brain is operating. And then if we see what that is, then we have a roadmap, right? Then we can actually do something about it, as opposed to just throwing a pill at someone, which might help sometimes, but not every time.
Right. So this is very interesting. So the way that you are able to, like, let's say, diagnose a specific condition will have a specific activity in a specific region of the brain.
That's correct. Yeah.
Now, this is just me being very curious. I'm a scientist, but I study a very different side of science, which is physics and electromagnetic waves and all that kind of stuff. But this is very exciting to me, because now in the brain, when this specific activity you are able to identify in a specific region, can it have a positive and a negative?
100%.
Okay.
And that, I'm so glad you brought it up, because oftentimes when people are seeking care, they are so focused on the negative attributes of how a part of their brain is functioning. But I tell most people, every strength has a weakness that can be associated with it. And so I'll give you examples in the brain. There's a part of the brain called the anterior cingulate gyrus, and it's located basically where my fingers would intersect. And you can think of that as the brain's gear shifter. So when it is calm and operating the way it's intended to, we're flexible. We switch gears, things roll off our back, we don't ruminate, we don't obsess. When it heats up, our gear shifter gets stuck, and we're more likely to feel like there's a hamster running on a wheel in our brain. We overthink, we hyper-focus but have a hard time shifting focus, we worry, we ruminate, we hold grudges. In kids, it can look like oppositionality, automatic no's. The flip side is people wired that way are also extremely persistent and extremely strong-willed.
Right.
And most CEOs, high-level actors, doctors, lawyers that I've had as patients almost always have that part of their brain heating up. So it becomes, how do you leverage that, right? Like,
right.
How do you tap into that as a strength, but then also have the insight to know when that firing is not serving you?
It's very interesting. And I'll tell you why it's very interesting to me personally is I'm a meditation teacher with the Art of Living Foundation. And a lot of the teachings are derived from these very ancient texts based in the yogic and the Vedic philosophy, right? And the founder of the Art of Living, Gurudev, he leads this silent retreat. And within the silent retreat, he walks through different meditations for different emotions. And he always says that the same energy which can constitute a negative emotion can also constitute a positive emotion. And as long as you take your awareness there, that same energy can flip from negative to positive. Now you're saying that there's something inside of the brain which is actually, the science is saying the same thing.
It's amazing, right? I mean, the same conclusion drawn from two different ways of understanding the human brain and humanity at large. And there's so many other examples too, you know, anxiety, right? So many people out there deal with anxiety.
Yes.
And the part of the brain that tends to be very active when people are in that state are the basal ganglia, deep inside the brain. You can think of them almost as the fight or flight centers of the brain. And when they're active, people feel restless, people feel anxious, people feel nervous, tense, you know, unsettled. But they also tend to be the people who are driven, you know, motivated, type A, maybe perfectionistic tendencies, which when harnessed can be a good thing, right? Can be very, very helpful, as opposed to someone whose basal ganglia are completely calm and mellow. They might be a couch potato, right? So there's good in that finding if it's contained, if it's harnessed, if it's managed. And the first step is insight.
So the first step is knowing about this, right? So let's go deeper into that. Let's say if somebody's going through, like say, a specific condition, right? How do they first even become aware that they're going through something like this? And then how can they get their brain scanned? Like how, like I want to get my brain scanned just listening to you right now.
You should. I will scan your brain.
There you go.
So, I mean, first step is to really take an inventory of distress level and functionality, right? Like, am I experiencing certain symptoms that are impacting my ability to think, my ability to connect with people, my relationships, my livelihood, my overall sense of well-being, right? And if the answer there is yes, then you dive deeper. And the way that people can get connected with Amen clinics is we have 11 sites across the country, spanning from coast to coast. I work in the Encino site in Los Angeles, but it's one of 11. And we have people come in from all over the country, all over the world actually, to get scans done. And then when they're in the clinic, we usually do 2 days of scans, one where the person is concentrating right before the scan, another where they're relaxing, which helps us compare two states, which gives us more information. While they're in the clinic, they also do some computerized neuropsych testing and meet with a patient historian who gathers lots and lots of information and compiles all that together. And then once all that's done, they meet with one of the psychiatrists, of which I am one, and that meeting is 2 hours. And prior to the meeting, the psychiatrist will have gone through all the information already. So you're starting off with a person working with you who understands a lot of what's going on, and then the conversation begins, as opposed to a 30-minute visit where someone is just taking a quick inventory of things. And then we see, right? We see what the picture shows, literally with the scan, but also the overall picture. It's not only about the scan, and build a targeted plan based on what we find.
It's very interesting. So I'm guessing you take the relaxed picture to kind of give you the baseline. Okay, this is what the person's baseline is, and now when they're concentrating, this is what regions get fired up.
Yeah.
No.
Yeah,
Go ahead.
it's actually interesting because in a brain that is dealing with nothing, the two states are not so dissimilar, right? The baseline state and the concentrating state. However, let's take ADHD as an example.
Yeah.
In ADHD, when the person goes to concentrate, their prefrontal cortex deactivates. Ultimately, ADHD is a supply-demand issue. Is blood flow supply to the prefrontal cortex keeping up with the demands being placed on it? So in a non-ADHD brain, when the person goes to concentrate, demands go up, blood flow supply goes up. Overall, that region will look about the same on a scan. In an ADHD brain, demand goes up, supply doesn't keep up, and now you see on these scans what appear to be holes that open up. Not literal holes, but regions where blood flow and activity becomes relatively suppressed. But then I have other people who, in their baseline scan, it lights up like a Christmas tree. Their brain is everywhere, right? They have, we're in Los Angeles, they have the 405 freeway during rush hour inside their brain. And then when they go to concentrate, things calm. So that's a person who generally, when they're involved in something, when they're engaged in something, they feel calmer. But when they're just sitting with their own thoughts, like before bed, they have a hard time falling asleep.
Wow. So, a personal revelation on why I really wanted to talk to you. So my grandma, unfortunately, she is going through a case of dementia, right? Where it's at a state, and I haven't shared this publicly before, where she's at a stage where she doesn't even recognize the close family members. And it's
so hard.
It's very hard for us because, especially for my family who's taking care of her in India. Now, for me, I speak to her every once in a while on the phone, and inside of me, I can empathize with someone going through that. And it's also disheartening that my nani, she doesn't probably even remember my name, right? Or she remembers my name, but she cannot associate me with who I am. And now, which part of the brain is memory connected to? And is that part of the brain, how does that connect to even the modern day symptoms like attention deficiency, or what the kids right now are going through? Now, is it all connected? Is it something that people do at a young age that leads to this condition in the older age, or how does this even work?
Such a great question. And first of all, thank you for sharing. Dementia is one of the most difficult diagnoses, just because of what it robs from a person, and a family. What's interesting in our work is people often think of dementia as a diagnosis that you receive and then you deal with it, And that's the traditional model of diagnosis, because usually someone is getting diagnosed when they're well along their way in demonstrating symptoms. What's interesting in our work is you can see signs that someone might be headed towards a dementia picture decades before they ever show symptoms.
Wow.
And the parts of the brain that tend to be most involved, it depends on the type of dementia, but for most types, it's the temporal lobes, which are located right by the temples. And within the body of the temporal lobe is the hippocampus. It's the main memory structure of the brain. And when blood flow and activity to that region drop, our ability to retain and recall memories also drops. And we actually put together an acronym that sort of encompasses lots of different risk factors that people can accumulate over time that can eventually lead to the phenotype of dementia. And the acronym is Bright Minds. I'll go through it.
Yeah.
The B stands for blood flow.
Okay.
So things like uncontrolled hypertension, diabetes, history of stroke, not exercising, right? The R is retirement/aging. So aging in and of itself is associated with diminished blood flow to the brain. But there's also aspects of aging that are most detrimental, and that's things like loneliness, isolation, not learning new things. The I stands for inflammation. So anything that increases inflammation in the body, it could be an uncontrolled medical condition. It could be diet and the food that we put into our body. It could be gum disease, right? Where am I at now? G. G is genetics. So a family history of dementia increases risk. Obviously, we can't modify our genetics, but it's something to be aware of, because if that's present, we better lean in to the other risk factors quite a bit. The H is head injury. So it turns out that head injuries, regardless of where you've been impacted, lead to the brain essentially wobbling back and forth within the skull. And the temporal lobes are housed in a bony cavity. And when they rattle within that bony cavity, it can affect how blood flows to them. So head injuries. T stands for toxins. So any type of toxic exposures, that could be pollution, mold, heavy metals, being aware of that and managing that. The M is mental health conditions. So chronic stress, it turns out, right? Chronic stress diminishes blood flow to the temporal lobes. And people who have lived a life of high stress levels are going to be more likely to demonstrate memory impairment later in life. So managing that, like with the type of things you do and teach, is extremely important, right? Not just for our current functioning, but our future functioning. Help me with my own ADHD. What letter am I on now? I think I'm on
T.
I now.
You finished T.
Oh, I finished T, and then M for mental health, and then I, infection. So
it's bright mind.
Bright minds.
Okay,
yeah.
I thought it was only bright. Okay,
No, bright minds.
Okay.
Yeah, it keeps going.
Okay. So mental health, and then
the I would be infections, chronic infections. Sometimes people are dealing with things like whether it's Lyme or EBV, and may or may not be aware of that. N would be neurohormone deficiencies, so things like testosterone level, other sex hormones. D is diabetes, so in early stages of life, being overweight is a risk factor for developing dementia later in life.
Got it.
When we're older, being underweight is actually the risk factor, so making sure people are getting good nutrition. And then finally, the S is sleep. Sleep. So chronic insomnia, sleep apnea. So for a given person, we try to go through all these factors. If the reason they're presenting is either signs of dementia or a family history or early symptoms or just someone who wants to optimize their brain to not go that route, we'll look at the whole assessment, we'll look at the scans, we'll go through those factors and think, where do we want to invest the most energy?
Okay, so from this framework, the bright minds, which are like the top 2 or the top 3, which would affect the most?
For me, the 3 pillars of brain health are sleep, exercise, and nutrition.
Okay, so let's stay there. Sleep, exercise, and nutrition. Now, how much sleep and the quality?
Depends on the person, depends on the age, because remember, I'm also a child, adolescent, and adult psychiatrist.
Right.
And you also mentioned quality.
Yes.
As a general guideline, something around 8 hours is probably advisable.
Yeah.
Different people have different sleep needs, though.
Of course.
The quality is so important. And what I tell people is I really have 3 sleep tips that are applicable to most people. One is, especially for adults, wake up the same time every day and try to get sun on your face. And if you can't get sun, buy a little bright light therapy lamp. Because when you wake up, sets your circadian rhythm for the next 24 hours.
Right.
And it's even more important than when you go to bed. If you wake up the same time each day, you probably will end up going to bed at around the same time.
Yeah.
But wake up the same time each day, get sun on your face. The other is only use the bed for sleep or intimacy, nothing else, right? There's this concept called sleep efficiency, which essentially is how many hours are you sleeping in bed, and divide that by how many hours are you in bed, period, over a 24-hour period.
Right.
So if someone's sleeping 6 hours, but they're in bed for 10, their sleep efficiency is 60%, which would be terrible. You want it to be at least 90%. So what that means is don't be in bed unless you're sleeping or intimacy. And then the third one, and this is a big topic that we could probably spend 3 hours on, would be screens. Our brain has not evolved to be able to differentiate light from the sun versus light from a screen And so many people rely on a screen to almost hypnotize themselves to sleep. And it'll get you to sleep.
Yeah.
But you won't get into deep sleep. And sleep is such an active process in the brain. It's not the brain turning off, as you know. It's the brain is consolidating memories. It's cleaning itself. Like we have to progress through the stages that we're intended to. And light from a screen totally diminishes that capacity. So I tell people at a minimum an hour before bed, screens off, right? Like dock your phone, TV, turn it off. If you need something to listen to your podcast, you know, as opposed to something coming from a screen.
Hey, a quick pause. If you're listening to this and thinking, I need more peace in my day, more clarity in my mind, then I'll really encourage you to check out The Art of Living. The Art of Living offers a technique called sky breath meditation, used by CEOs, pro athletes, and high performers around the world to recharge their energy, clear that mental fog, and reset the nervous system in minutes. They offer programs both online and in person. It is science-backed and it works. Head to artofliving.org to learn more. Interesting. Okay, because I found myself doing that. Like it'll be nice when I'll be scrolling through Instagram,
We've
watching
all done
some
it.
reels,
Yeah.
right? And then you tend to fall asleep after some time. You're like, turn it off, and then you just go to sleep, right? So the brain doesn't know if this light that's coming off of the screen, it's not the light from the sun. Light is light for the brain.
Correct.
And then does it take that much longer time to go to deep sleep, or does it affect the deep sleep stage totally?
It'll delay onset to deep sleep, and it will diminish the total amount of time in deep sleep.
Okay.
Yeah.
So both.
Both.
Interesting.
Yeah.
And now when the brain's not in deep sleep, then it does not get the opportunity to clean itself or clear itself of the impressions from that day or even from before.
Correct. And chronic poor sleep is associated with increased inflammation in the body. And inflammation, if you think about it, is root cause for most disease, right? Like if you isolate any given condition and you take it down to a cellular level and what's happening, inflammation is almost always at the root cause. So chronic poor sleep increases inflammation, and now we're setting ourselves up for all sorts of issues.
Basically, the healing mechanism for the body, nature has given us that already in the form of sleep.
Yes.
So, and when we don't prioritize that, then we are setting ourselves up for disease anyways.
Absolutely.
If not now, then at a future stage.
Absolutely. The body wants to heal itself. Our body is an incredible organism, right? Sometimes we get in the way. And it wants to heal itself when we give it the environment that allows it to, But sleep deprivation is one, and it's one of the first things to go for many people. People get busy, I need to cut time from somewhere, and that's going to be sleep. Or people, I see commonly revenge insomnia, which I've worked so hard today. I'm just going to stay up a couple more hours because I deserve this time and I need this time. And I myself have done revenge insomnia from time to time, but I'm intentional about it. Like I know that I'm doing it and I know what the cost will be. But every now and then I feel like truly that's something I need right now. But sleep is a big topic, and it's the first of those three brain pillars.
Let's go to the second one.
Exercise. Yeah, exercise.
So this has been a question that I'm always curious about. What constitutes as exercise? Is it just walking every day and that's good enough for most people, or does it have to be lifting weights? Like, what intensity is optimal for an average human being? I'm not talking about UFC fighters or athletes, right? Like for people like you and me.
You've had some on,
So what would be your advice there?
There is a lot of variation, even by gender, by age, but from a purely brain health perspective, I'm all about efficiency. And I think the most efficient thing you can do for your brain would be 20 minutes, not a huge time commitment, of higher intensity aerobic exercise, right? So cardio.
Got it.
4 days a week. And I say that number because that has actually been shown in plenty of research studies to be associated with better outcomes in depression than antidepressant medications. It can be harder to commit to doing something for 20 minutes, 4 days a week than, swallowing a pill. But ultimately, that type of exercise does a few things for the brain. It increases endorphins. It increases serotonin naturally. Serotonin has a very calming effect on emotional centers that are overactive. At the same time, it's promoting good blood flow and oxygen to your brain. The first branch off the aorta goes straight to our brain. And so when we're engaged in that type of cardio, our heart is pumping more efficiently, more quickly, we're breathing in more deeply. That oxygen-rich blood is feeding our brain, so sleepy areas of the brain are getting replenished. And then also on top of all that, you're sweating, right? You're sweating out toxins. So it's just hitting on so many levels that tends to be kind of like a core recommendation I make for many people. Now, strength training is important for other reasons too, like maintaining muscle mass and testosterone level, bone density. But from a purely brain health perspective, I think if everyone was doing 20 minutes of high intensity cardio as tolerated for them 4 days a week, they would see significant changes in their life.
Makes sense. And let's say it has to be supplemented with the right kind of nutrition.
Yes.
That's your third point.
That's the third pillar.
I'm a vegetarian, right? And more than half the country where I come from is a vegetarian.
Yeah.
Right. Now, are there what vegetarian sources of good food can we have in our daily diet, or what are some food habits that can also, contribute towards a good brain health?
Absolutely. So the first thing I think about with food is it's either good for your brain or bad for your brain, right?
Okay.
I mean, for the most part, you can work hard to just ask yourself that question each time. The thing in front of me right now, is it good for my brain or bad for my brain? And here's the guidelines you sort of use. The three things that are almost universally bad for our brain: sugar, especially refined sugar. And so many products have hidden sugar in them. All sorts of things. Processed foods is a big topic. If the average person were to sit down and read all of the ingredients in the things that they are eating, they would be very surprised to see things that they can't pronounce and to see things that are food-like substances but not actual food. And the rule of thumb is, if you can't pronounce it, don't eat it. If you couldn't buy that same ingredient on its own in the grocery store that you're in, probably a good idea to avoid it. There was a big study out of Harvard a couple years ago that looked at something like 40,000 women and that tracked them over about 15 years or so. And at the start of the study, nobody had depression. It was actually an exclusion criteria for the study. By the end of the study, lots of people had depression. And then the researchers went through and analyzed all the different variables they could think of, right? Socioeconomic status, smoking, traumas, et cetera, et cetera. And statistically, they were able to isolate processed foods as a huge risk factor. So the women in that study who were at the highest 20% of consuming processed foods had a 50% higher likelihood of developing depression by the end of the study.
Wow.
And again, that's controlling for things like income, geography, et cetera.
Right.
So processed food inflames the brain, ultimately. And again, inflammation is root cause for so much disease. And then the third one, and some of this depends on where someone lives, but especially in the US, gluten can be an issue with how it's been raised over centuries. So breads, pastas, cereals, but it depends on where wheat is coming from. So my wife is a gastroenterologist, and she has patients who have celiac disease who in the US, if they consume any kind of wheat, they have major flare-ups in their symptoms. And then some of them have traveled to Italy and have indulged on some pasta and felt okay. It's different in different regions of the world.
Is it because it's processed differently, or?
That's a good question. I'm not sure exactly what the details are there, but I've seen it many, many times. It is just fundamentally different.
Interesting.
And then in terms of the things that are good for our brain, protein, right? And in a vegetarian diet, I mean, you can achieve good protein intake from all sorts of sources. What are your favorites?
My favorite is paneer. Do you know what paneer is? You know, when milk gets curdled, you can turn it into this cottage cheese type substance. That's my favorite one. I sometimes even enjoy a little bit of tofu, soy, and then legumes, lentils. I'm a big fan of lentils and garbanzo beans and stuff like that is where, you know, those are my favorite ones personally.
Fantastic, I mean, it's cottage cheese, if you look at it like calorie to protein ratio, it's actually the richest in protein even compared to animal products.
Oh, really?
Yeah, I mean, that's a great source of protein. So protein, key, healthy fat. Our brain is 60% fat after you take the water out. So a lot of people, you know, in society, we had this whole wave of like things are fat free, et cetera. That's not necessarily good, right? Like you need fat. And so healthy sources include avocados, avocado oil, olive oil, nuts, seeds, coconut, you know, assuming no allergies to those things. Fruits and vegetables, I tell people the ideal is to eat the rainbow every day, but not from a bag of Skittles. And then complex carbs, you know, things like sweet potato, quinoa, wild rice. Ultimately, you're looking for things that don't spike and drop your blood sugar, because that is associated with inflammation, but also decreased brain function. You're looking for things that give you a slow, steady blood sugar over the course of the day.
Wow. Okay. Dr. Steven, so there's different varieties of mental, I would say, conditions, right? I've heard anxiety, I've heard depression, I've heard you talk about ADHD. We definitely touched upon dementia. How many of these are connected to each other? Do you see there's a pattern in people who would display signs of depression and they would tend to also get more anxious about the future? Or, you know, tell us about the correlations between different mental, let's say, conditions.
Such a great question. And ultimately, there is so much overlap between all of these artificial labels. Because as I mentioned at the start, those labels aren't based in neuroscience. But if you look at the actual neuroscience, there are pathways in the brain that overlap between how all of these different symptoms manifest. So I'll give you an example, right? ADHD, very common topic, you know, nowadays. ADHD, first of all, there's many different types in our work, about 7 different types we've identified based on how blood flows through the brain. But the fundamental core principle is relative to the rest of the brain, that prefrontal cortex is sleepy or underactive, okay? And so that's the executive center, and it would be associated with things like difficulty focusing, disorganization, hard time with follow-through, but also impulse control challenges, because ultimately the prefrontal cortex is our brain's brake pedal. And if it's relatively sleepy, we have a hard time hitting the brakes. And that could look like blurting things out, but it can also look like having a hard time pumping the brakes on a thought loop that we're having, or on an emotion that we're having. And so if you look at other conditions in psychiatry, like OCD, obsessive compulsive disorder, it is also associated with reduced activity in the prefrontal cortex. And if you look at a psychiatry textbook and you look up OCD and comorbid conditions, ADHD is always number 1, right? And the reason is there's a shared underlying circuitry for both, right? In ADHD, it's more impulsivity and, you know, behavioral regulation. In OCD, it's more regulating our thoughts. But other things too, skin picking, hair pulling, tic disorders, you know, all of those are associated with reduced activity in the prefrontal cortex. Even binge eating, reduced activity in the prefrontal cortex. It's a reason why there's a medication that is often used in binge eating, and guess what? It's an ADHD medicine. It's Vyvanse, which is a stimulant that increases activity in the prefrontal cortex. That's one example. Depression and anxiety you brought up, I think of those as 2 sides of the same coin. Because most people who deal with either condition will experience the other as well. And not to oversimplify it, but I think of it as commonly going down one of two different paths. There are many people who depression is in the driver's seat, so to speak, and that's the thing that's really the most impairing for them. And anxiety might actually be a coping mechanism, right? Because if we can just stay above water, right? I'm all about images, and the image I get is someone in the deep end of a pool treading water, Yeah. The treading is anxiety, and if they stop, they feel like they're sinking, right? But then there's also the person where anxiety is really the driver, and they burn out and enter a depression. So, and again, figuring out which is in the driver's seat is really important, because you don't want to just treat secondary symptoms.
Right. In my teaching career, when I teach, breathing and meditation, in the Art of Living, we teach this very specific breathing technique. It's called the sky breath meditation. Gurudev came up with this technique almost 4 decades ago, and rooted in like ancient philosophy, right? Now, what it does, it's like different. It's breathing in different rhythms at a certain pace and over a certain number of times. And I've been practicing it from 2 decades, and almost every day, once I practice it, I feel great. And not just that, I find that after the breathing, I enter this very flowy meditative state very easily. What do you reckon is happening in my brain, both during the breathing? Why do I feel so great? And there might be days when I'm feeling anxious, when I'm feeling stuck in a loop, thought pattern, and I'm immediately able to snap out of it. I'm immediately not just able to snap out of it, but enter a different state altogether, which is very meditative, very calm. What's happening in my brain?
Such an amazing tool to have. And I talk with many of my patients about the balance in the nervous system between sympathetic and parasympathetic. Sympathetic being fight or flight, right?
Yep.
We talked about the basal ganglia earlier, deep inside the brain. And someone who is wired sympathetic, or when we're in that moment where we're feeling really tense and our thoughts are circulating and we're restless, you can bet that your basal ganglia are probably firing up, which means your sympathetic nervous system is dominating the other side, the parasympathetic nervous system. And that is associated with clear thinking, right? Deep sleep, calm, digestion. And so I think probably what's happening in those moments is you're activating your parasympathetic nervous system. Yeah, deep breathing,
Right.
You're the expert, not me, but it's associated with stimulating the vagus nerve. The vagus nerve has so many parasympathetic fibers on it. And so now you're shifting to more parasympathetic. And deep breathing is one amazing example of that. There are others too, right? I mean, yoga, acupuncture, massage, cold plunge, even vagus nerve stimulator devices. It's whatever is accessible to a given person. But in that moment, you're shifting the scales and thinking a little bit more clearly, as opposed to getting on that rat wheel.
Right. And what happens? What's meditation to you? What happens to the brain when it's? I can describe what meditation feels like to me. I enter this very calm, quiet state of mind. I feel connected, almost to something beyond me. Right. Now, what's happening? What happens in the brain? If I were to get a scan while I'm meditating, what would it show?
So we've done this.
Oh, we have done that. Okay.
And remember when I talked about how some people have a baseline scan that looks like a freeway during rush hour? We've had a couple master meditators come in and do the scan while they're not meditating and while they're meditating. And usually what we've seen is that noise just goes down, right? It's a brain that is, it's the middle of the night on the freeway as opposed to rush hour. Yeah. And if we don't have that level of background noise in our brain, we are able to think so much more clearly and feel so much more at peace. So meditation, therapy, it's also influencing biology on a very deep level, which you already knew.
Yeah. No, I've read about it, right? And then, in terms of the research, and I felt it, right? More than anything else. To this day, it always excites me when, it lights me up when I hear what's actually happening inside my body. And one day maybe I would love to.
When you come in for your scans,
Yeah.
maybe instead of doing the traditional baseline and concentration scan, we'll do a baseline and meditating scan.
Let's do it.
I think that would be really fascinating.
Let's do it. And I'm partnering with this really cool institute. It's called the Institute of Absolute Intelligence. It's a partner with the Art of Living. And one of the offerings from the institute is training these small kids into intuition, right? And some of these kids with practices with some meditation techniques their intuition is so heightened that they're able to see while blindfolded.
Wow.
Now, when I saw those videos, I was like, well, there's got to be something happening. Like maybe they can see through the blindfolds and it's just on camera. But then I got in front of some of these kids and they're doing like some really crazy stuff,
Wow.
And I've seen it in front of my own eyes. And I was, let's do some research. Like I'm interested to hear your thoughts on intuition, and where do you think that stems from? Which part of the brain is that coming from? And what's happening there? Like, why is it that some kids are able to do something like that and not others?
Yeah. So based on our current understanding, which even though this type of work is diving into a whole nother deep level that traditional psychiatry hasn't, again, the brain is more connections than the stars in the universe. So it's probably much deeper than what I'm about to say. But when you look at a population, when people are described as more intuitive, perceptive, deeply feeling, sensitive, people who pick up on things, people who feel energy, the part of their brain that tends to light up more than others is something called the thalamus.
Okay.
And that's also deep inside the brain. You can think of the thalamus as almost the emotional gatekeeper to the brain. And it is, all sensation has to pass through the thalamus before it gets to our conscious awareness. So the whole nervous system, right? All those nerves travel from the body, through the spinal cord, through the thalamus, up into the brain. So people with a very active thalamus seem to be more intuitive, more perceptive. The flip side, because we talked about flip sides earlier, is they can also be more likely to deal with depression because they do feel things so deeply. So again, one of these ideas of knowing what your strengths are and channeling those as best you can.
Interesting. What's the most common issue that you think that people come to you with? Is it depression or ADHD or
It's probably the trifecta of depression, ADHD, and anxiety. But we see head injury, we see cognitive decline, we see bipolar disorder, or what has been diagnosed as bipolar disorder, which oftentimes ends up being a misdiagnosis. Psychotic disorders, all sorts of things. Yeah.
Where does science stand on something like schizophrenia? What's happening there? And I know there are people in my circle whose relatives have gone through schizophrenic episodes. To the outside world, it can seem very scary, and I can't imagine what's happening through a person's head who's going through it.
Yes.
Right? And I want everybody who's listening to this conversation, while we're talking through this, it's also not diminishing anybody's experience. We just want to know, because when we know, we can do something about it. Right?
Absolutely.
And that's the whole intention of this conversation. What's happening there, do you think, during a schizophrenic episode?
Yeah, and in terms of diminishing experience, everyone's experience is unique, right?
Yeah.
Every brain scan I've ever seen is unique, right? I've seen thousands now, and I think of them as fingerprints, right? There's no two brains that are wired exactly the same. So we're looking for patterns to help point us in the right direction, but every brain is unique. In schizophrenia, it's similar to depression. You can see two people who are displaying symptoms of schizophrenia, and those two people can have radically different brain scans because it's not just one root cause, right? So part of it is figuring out what the actual root cause is. Is it a chronic undiagnosed infection that's impacting how the brain is firing? Is it a toxic exposure or a substance? Is it an unmasking of an underlying genetic condition? Oftentimes what you'll see in schizophrenia is, again, altered function in the temporal lobes, because in addition to the temporal lobes being important for memory, they're also important for perception. And the very challenging thing for people who deal with a psychotic disorder is our brain is so powerful and perception is reality, right? I mean, the way we perceive the world around us, to us, is very true. Us sitting here, you in front of me.
Yeah.
I mean, this is all my brain telling me that this is so.
Right.
And fortunately for me, your brain is telling you the same thing.
That's
and
true.
so we're aligned, right? But
Yeah.
if my brain was telling me something different, and then everyone else in this room was saying that my reality is untrue, it's going to be very hard for me to accept that.
Right.
Because I have relied on my senses my entire life.
Right.
And so a big part of treatment of psychotic disorders is to help someone understand that, so that there's trust in the process. Because otherwise, you know, someone's saying, here, no, take this medicine, you're thinking differently. No, like, I'm not going to take that.
Yeah.
Yeah.
Wow. And this is, I mean, I my heart goes out to people who, you know, who go through an experience like that. What can we do to help them? And what does, like, I know you already talked about sleep, exercise, and nutrition. Any last advice that you would leave for our listeners, where something that they should absolutely not discount, right? A practice, a habit that they should absolutely not let go of, or if they've let go of it, they should start picking it up again. What is something that they should focus on?
I would say two things. One, and this is for kindness to ourselves, but also kindness to people in our lives and complete strangers, is to remember that mental health is brain health. If someone is exhibiting symptoms, it's not necessarily that they are choosing to do so, or they have the control to start or stop, or that they have gone crazy, quote unquote, whatever that means. It is how their brain is firing. And if we can step into that level of understanding, it builds empathy and creates more opportunity to actually help people, and for people to feel less vulnerable so that they can help themselves. The other one I would say is, don't believe every stupid thought you have. We are riddled with automatic negative thoughts over the course of a day. You know, our brain feeds us, I don't even know how many, probably depends on the person, but we're not even always aware that an automatic negative thought is going through our mind. We just react to the emotion that it generates.
Right.
And I think as a general practice that's helpful for most people is, when you notice an emotional shift, hit the pause button, try to identify what you were just thinking about, try to isolate that to what the automatic negative thought was, and then analyze it. Right? Is that thought true? If I were before a judge, would the judge declare that thought to be true, or is there any chance it's not? And if there's any chance it's not, let's create a more accurate version of that thought, right? Something that's not just rose-colored lenses, but just accurate, right? And then see how you feel.
Wonderful. Thank you so much, Stephen, for your time today.
It's been a pleasure.
So nice talking to you. It felt like, I mean, we talked for almost an hour, and it feels like we just started.
Absolutely.
Maybe we should sit down one more time and go deeper into all
after
of
your
aspects.
scans.
Yes, let's do it. So let's do an episode on my scans.
I think that could be really cool, actually.
Yeah, I think that would be great.
Yeah.
Thank you so much, Stephen, for your time. It was
You're welcome.
wonderful having you on.
Thank you. Thank you so much.
Hey, a quick pause. I want to share a resource I've personally trusted for years. And when it comes to living well, not just in moments of meditation or reflection, but in everyday life, what we put into our bodies matters deeply. And that is why I love Shri Shri Tattva. It's a brand rooted in authentic Ayurveda, from daily wellness supplements to natural personal care, all crafted with ancient wisdom and modern purity. No shortcuts, no hypes, just products that support real well-being from the inside out. For me, it's all about alignment between what I practice and what I teach and how I live. And Shri Shri Tattva helps me bring some of that care into my daily routine. You can explore their offerings at shrishrittattvausa.com. I highly recommend checking them out. The link is also in my description below. I want to share something I've been personally loving. Shankara's Ghee Sutra is one of those rare products where ancient wisdom meets modern skincare. It's crafted from ghee that's churned 10,000 times. Yes, 10,000. Blended with Ayurvedic botanicals like hibiscus, bamboo, and it penetrates deep, up to 7 layers, to nourish, hydrate, and bring your skin back to life. No harsh chemicals, no surface level fixes, just deep, authentic care from the inside out, like everything we talk about on this show. You can check it out at shankara.com